Hello, hello, and welcome to another episode of the Dear Misfits podcast. I'm Isaiah, and with me as always,
I'm Amy. Hi, friends.
So glad you could join us for an episode of Video Proportions. What
a journey it has been,
it has been
for us novices to figure this out.
All the tech troubleshooting that we've been going through has been, it's a great opportunity to test patience and give grace for ourselves.
If you ever wonder how people go to college for sound or lighting, we way better understand that now. Really good job, people.
There's a science to it, and
two anal retentive people trying to figure that out who haven't been trained in it. It's just
complex.
Yeah, we'll call it complex.
You also actually might have noticed that we have a new background, a new setting. We are in Europe. No, I'm just kidding. We moved locations.
No, Ireland.
Ireland. No, we're still in the Cedar Valley. But we're a new location, and it'll be a lot more helpful for us as we're doing video portions of these exercises and interventions. Easy access to some tables and things like that as we're going forward. Today, though, is a companion episode. We've done a podcast episode with the neck and some exercises that we talked about in the video. Well, the video itself didn't quite survive the recording process. So this is the companion episode for our podcast that we talk about the neck and some musculoskeletal exercises to go with it. We're going to keep this one a little shorter, a little more brief, and get right to the meat and potatoes of these exercises. But this is all about working on muscle and skeletal aspects for the neck. In another episode that we'll do here in the near future, we'll be talking a little bit more about anxiety and stress storage and how you can work on those things as well. Without further ado, let's get right into doing some of these exercises. One of my favorite ones, the number one muscle that I like to think of as a helper, one that it wants to help out, it's really overzealous about it, however, and it's called the upper trap. Now that's the muscle that sits from here at the base of your neck and comes all the way out and down. Those fibers attach all the way down to here. This muscle gets really tense, and if you are going through a period of either discomfort, pain, or stress, your shoulders tend to do this. Or if you're reaching for a cup of coffee, your shoulder raises up as you reach out for that cup of coffee. If we're doing rows or doing exercises, the shoulders lift up, and they shouldn't have to, and they shouldn't be doing this. And it happens though, as a way to protect, as a way to help, as a way to engage. The upper trap is just very, very overzealous about those kind of things. Let's go through a stretch that you can do to loosen this tissue up. Now we all know how long to hold a stretch. If you've listened to any of these other episodes, you would know that 30 seconds, I'm very picky on, well, just about everything. And that includes how long to hold a stretch. If we're going to do the upper trap stretch, if we're saying, let's do the right shoulder, the right upper trap. To do that, you're going to tip your left ear down towards your shoulder. And as you tip your left ear down towards the shoulder, you may start to feel a little bit of a buildup of pull. You may not. Let's add a little bit more. You're going to tuck the chin in, looking towards your opposite shoulder. That starts to build and wind up a lot of that tension. And that's where I give you the main aspect of this stretch, and you dial it in from there as you are trying to do. If you're here and you're like, well, I think I'd get a bit more actually if I stay a bit higher up, or I get a bit more if I rotate a little bit or tuck down. Think about these exercises, these interventions that we provide as a radio station. Say it's 94.3, for example. And I give you this radio station to access and go to. You get there, but just like any other radio station, radio dial, you might have to go just a bit up or just a bit down on that dial to get the most clarity out of it for you and your station. So when you get to it, this is getting to that 94.3. And then you just dial it in to you and your body and how you're feeling to get the most out of each individual one. Did you want anything you want to add to that one?
No, I just typically would say along those lines, so if you're side bending away, I always tell people and patients to smell their armpit. Isaiah likes to say, look to the opposite one. So that's where I think it's important that you see use the guide and then adjust it. The guide being the basic of the exercise, and then you adjust it. So, and it's important too, with the stretch timing of that, your trap is a muscle that is innervated by your nervous system in a way that is part of your fight or flight or startle reflex. And so when your body or mind's feeling stressed and you're catching yourself like being like, oh, I gotta get my elbows, shoulders away from your ears, that's a little indicator that you have a little fight or flight going on. And it's hard to just say, oh, I shouldn't do that. I shouldn't, if they're tight, I should hold them down. Don't hold them down. Figure out how to let them go. And part of that's because they're tight and you need a stretch, but part of it might be because you have a nervous system that you need to get chilled out a little bit. And if you are like, but I am feeling relaxed, really maybe like we encourage you to do some of the interoception stuff that we've talked about in the past, because how many times people come in saying, oh, I'm feeling pretty good. I'm not stressed out, but their system is feeling stressed out. And is pretty frequently.
Very frequent.
One of the big indicators is that people are pretty aware of when their shoulders are being elevated, but what to do about it and like to actually intervene is a little bit different story. So that with the trap muscle, that's just something I wanted you to consider. And it's a huge muscle that it implicates a lot of your shoulder, neck, upper back, lower back, rib cage. So it's one to first get your system regulated, secondly stretch out appropriately, and then take care of like why is there such an imbalance in it.
Yep. Along the lines of that, more because this next stretch actually is a similar setup as the one we just did, is one of the largest neck muscles in the body, actually starts in the front and is called the sternocleidomastoid. It's a big crazy name here because it attaches to 3 places: the sternum, the collarbone, and then right behind the ear there's this process called the mastoid process. And so it actually travels this entire length up the neck and attaches to the back behind the ear. When you're doing this stretch, you actually may feel it more at the ear rather than in the front of the neck, but let's try and see where you're feeling it. You'll start by tilting your head. Same thing, let's use the right side as our example in the video, but I'm going to tilt my head then to the left. And instead of looking down like I'm trying to smell the armpit, I'm going to look up towards the sky and tilting back as I go. Now that in itself can be a good starting point for the stretch. However, if you want to get a little bit more, and I always like to try and get as much as I can at each individual one, I'll take my hand, the left one, I'll put it on my right collarbone, and what I'm going to do is I'm going to pull that tissue right off of that collarbone using the pads of my fingers along that edge of that collarbone. And I can feel more as I do that. I can feel it going up behind my ear, and that is your sternocleidomastoid. Same thing with any of the other stretches though, you got to hold it for that 30-second count.
And a little education background with that muscle. It's one that tends to become boss to stabilize your neck, and that's not its responsibility first. Those are like finer, deep neck muscles that tend to get inhibited from pain or repetitive strain posture patterns. So if when you grit your teeth and you see this big guy pop out and you feel it a lot or it's pronounced on you, it's not just necessarily about bodybuilding tone. It's about it probably overworking, and then that's a little sign to you to get back to some deep neck flexor strengthening, which we'll talk about in a second.
Yeah. And so those 2 big ones for stretching These are very common ones that we would prescribe in like the clinic as we're working with patients. It's also quite common to utilize with like our own purposes outside of the clinic. I have had last year 3 separate incidents where I woke up and had terrible neck pain, could barely move with my neck as I was trying to get about the day. And I had to really focus on adjusting how I sleep position for myself. And that's a bear in a whole nother topic, a whole nother episode talking about sleep positioning and adjusting that. But it got to the point where I did it like 3 times, like in the first half of the year, where it was very much in my face that I needed to make a change. And I use these stretches on a regular basis for like sleep positioning if I'm having trouble with that. If I've spent a lot of time doing notes like I just recently did as the end of the year was wrapping up, or if I'm in a very stressful or a lot of shoulder activity occurring during like a workout period during one of my regimens. And so I utilize these stretches in my daily life as well, just as much as I prescribe them. Super effective. I love them. As we were talking about some of these things that you could do at home, now you can take the time to work through these stretches. You can work them into more of a regular routine where maybe you do it first thing in the morning. You could do it at the end of the day, things like that. But there's some other ones that are easy access as well. If you're having a lot of tension building up around the ears, around the facial region, it's also a great calming exercise, and that's doing some gentle ear pulling. You can grab from the lobes. I like to hook my fingers into the bottom of that earlobe, just on top of where I could grab the lobes. I'm just going right there into the bottom of that canal. I'm not even putting my fingers into my ear, and I'm just doing a light pull down and then slightly outward. And the pull does not need to be aggressive whatsoever. But I would hold that. You could do it lying down, you could do it seated, you could probably do it upside down if you wanted, though gravity doesn't help you in that position. But I do a light hold just to open up some of the sinuses, which is great for the vagus nerve, just giving a little decrease in pressure there, helping it just to activate and to engage, which is your rest and digest nerve. But it also helps with a lot of tension that can be building up around this region. Some of that musculoskeletal or myofascial tension that can be building up, especially if you got that muscle coming up here back to this section.
We could go down a rabbit hole of why ear pulls are good. So we're going to leave it at
that for this episode.
That for right now, but huge. And then it's just a slow, sustained pull. That's the thing I want to make sure you remember. People want to boss it, like pinch it and pull it. It's more almost like it's the weight of your hand. And the tissue that it's connected to is a kind of tissue that responds to that sustained load. More is not better, meaning more pressure doesn't make it release better, particularly when you're dealing with all of the things in that region. And when we talk about SEM, or the sternocleidomastoid, the upper trap, when we talk about the things around, attaching up here and the ear pulls and the vagal nerve and the trigeminal nerve that gives you a lot of face or temple stuff, and it just is such a grand central station to kind of take care of. And I think one of the things that is really important is you can do these things, but if you don't adjust posturally how you're holding yourself, it's just like spinning your wheels. You just got to keep up. So certainly we're giving you ideas and pretty vanilla things that you can implicate wherever you are, but you got to make sure you attend to your posture.
For sure. And it's not that you need to have that perfect posture all times of the day. It's not that you need to be super erect or catching yourself being out of this more slumped forward position. It's that when you are actively refocusing in on where your body and what position you're in. If you had the most perfect posture where everything is in perfect alignment, but you never moved, that also isn't good. To be just stationary and not having movement, yes, everything's stacked very well, but if you're not moving, you're just trying to hold yourself in this very nice, perfect, neutral position, but not have movement with it, then you're having other problems occur. Maybe not so much from a muscle standpoint early on, but again, muscles like movement, the joints like movement, and so it's not about having perfect posture, but being attentive to getting yourself out of these bad positionings, over slumped position, or in the opposite, where people are always like super erect military posture. Neither of those are good for the system. But if you're in it for like 10 seconds, sure. But if you sit there in front of the screen working for an hour in any of these different positions, you're going to have some undue stress occur and undue strain on these muscles and ligaments and then the joints themselves. So it's not about having the perfect posture 24/7. It's about making sure that you stay attentive, refocus in periodically throughout the day, and get yourself into a better position. At the bare minimum, get yourself out of those bad ones.
Mm-hmm. Do you have time for one more?
Yeah.
So the deep neck flexor one of the things we give is chin retractions first, and that's when we're in a forward head posture and all these muscles we've been talking about are cinched down, or we're just statically bent in that posture. So chin tucks are a repetitive motion to try to limber up your cervical vertebrae. So it's mobilization with movement. And so when you're sitting up tall and you try to make a double chin, people they get like they're pressing their head back into their car seat or a wall or whatever. That's not really accurate. You're keeping your nose level and you're trying to make a double chin and shift your head back on your neck to an end point. And you repeat it. You can do it once if you're like a real sensitive headache type of person. You can do it once and kind of hold it by putting the web of your hand at your chin. But usually we want to use repetition to try to limber up the sticky joints. But the one thing I wanted to say with the chin tucks is when you get into your chin tuck, so I'm back as far as I can go, and I'm sitting in this comfy couch chair thing. But if I was sitting up more upright on a hard chair, I would be able to be in a really good healthy posture to my end range. And then if I nod my head, my bowling ball, I tip it down just a bit, I feel a little tension in the back of my head that's actually stretching your suboccipital muscles. And those guys need it. And they have nerves. There's nerves back there that when the suboccipitals are tight, they'll create like ram horn headaches or around behind your eyes or up on the frontal part of your head. And so keeping this triangle at the base of your head opened up and long is another thing that you can do. Again, and these are like, this one I tell people to do every time you're at a stoplight.
Yep.
Every time you check an email or every time you grab your water bottle to get a drink, something that you can create a positive trigger for to remind yourself to do a set and to keep you, it's like insurance to me. If you're not currently having issues with it, you're gonna if you have some posture issues. So work on some things that restore your postural position so you don't have to need it down the road or need more work down the road. We don't ever like insurance until we need it. So that's kind of how I think of those exercises. But like for me, I'm a person just for my life, have headaches. And so I have to really be attentive to that quite a bit. The chin tucks and then particularly the chin tuck with a nod. And I just kind of stay. If I'm really feeling spicy, I'll just stay. And, again, we determine what feels good to you and what little tweaks make you feel like you target that area a little bit better. But
Dialing it in, that radio station.
Dial it in.
So, again, we wanted to keep this one more concise. We have a podcast episode that also discusses some of this content, but if you're watching this, didn't get a chance to look at the actual exercises firsthand, so that's great. Stay tuned. We'll have some more episodes talking about anxiety, some tension creation, and how you can manage some of those through intervention. And thank you for tuning in to another episode of the Dear Misfits. Ta-ta for now.